Hi everyone, this is a video on IV push medication. So the first thing we do when we enter a patient's room is wash our hands and identify the patient. So here we have the MAR, we have the patient's name, date of birth, and MAR number. And then we look at the orders to see what needs to be given. So this patient has dilaudid 1 milligram PRN for pain. So on this dilaudid vial, we have 2 milligrams per 1 milliliter. So if we look at the board, 2 milligrams per 1 milliliter, in order to get 1 milligram, you need 0.5 milliliters. But before we give the dilaudid, we need to do a pain assessment and vitals to have a baseline to compare to after we give the medication. So we do that, we get the vitals, and then we drop them in. For the pain assessment, so IV hydromorphone is going to get to the patient very quickly. It's really potent, so you have to think about, is this an appropriate medication for right now? Are they going to get a procedure done where they need immediate pain relief, or is this a situation where you can give a PO pain medication? Also, for example, if the medication is PRN pain for every 6 hours, you have to make sure you look at the MAR and see, was this medication given 6 hours ago? Because if it was within that 6 hours, you can't give this PRN right now. So we're going to drop our med. If you don't know about hydromorphone, you just use the drug book in the room. And we have a dilution rate of 5 milliliters normal saline, and we have rate of administration over 2 to 3 minutes. So again, we're going to draw back 0.5 milliliters of air. Draw up 0.5. And this is a high alert medication, and depending on what hospital you work at, some of them want you to have a witness nurse to watch you wasting the med, and some hospitals need you to have a witness nurse when drawing up the med. So here at Wildcat Hospital, while you were drawing up and calculating, you would have needed your partner nurse to watch you do that and make sure everything's correct. And now we have the diluting. So this is a 10 milliliter flush. We're going to waste them into the trash can to make room for the dilaudid. Okay. And if you had more than one med to give, or you were going to leave the room, you need to label this with the dose and drug. But we're right here with the patient, and we're only giving one drug, so I'm going to leave it here on the table. And now it's time to flush the line and make sure it's patent. So we want to assess, is this hurting the patient? Is there any redness?
Please scrub the hub. Please scrub the hub.
Yes, we're going to scrub the hub. And we're going to push the saline in, making sure that's not burning the patient, making sure it's not difficult to get the saline in, just making sure the line is patent. Now it's time for the drug, and we're going to do our rites of assessment again before we give it. So we have the right patient. We checked that earlier. We have the right drug, hydromorphone, 1 milligram. We have the right dose. We have the right route, IV push, time, PRN, and documentation we can go over after we administer. So we're going to scrub the hub again. And as we looked up in the book, the rate of administration is over 2 to 3 minutes. So we take our watches and administer this over 2 to 3 minutes, pushing it slowly. So we're going to do a time lapse, and that was over 2 to 3 minutes. Next, we need to flush the line again because there's some medication in the line. And because that's the same medication, we need to do the same rate of administration. So this is going to go into the patient at 2 to 3 minutes. Scrub the hub again. And this goes in at 2 to 3 minutes. That's done. So for documentation, depending on what hospital you're at Wildcat Hospital, you need your signature next to what you administered, and then also your partner nurse's initials, since they watched you draw it up and calculate it. And then after you document, after a few minutes, you want to reassess your patient. You want to redo their vitals, ask them for their pain on the scale again, and make sure that what you gave is having the desired effect. And that's IV push medication.